Pick that up, sweetheart." Those were the first words Elena Martinez heard about herself at Sacred Heart Hospital, though they hadn't been spoken yet. They were coming. She didn't know it. Dr. Sterling didn't know it. None of the surgical team gathered in the glass-walled conference room at 6:53 a.m. on a Tuesday had any idea that the quiet floor nurse checking for lines in the pediatric ward had spent 15 years keeping people alive in places where the sand turned red and the sky screamed with incoming fire. She was just the new hire. The one who kept her head down. The one who'd appeared 3 months ago with a limp nobody asked about and hands that moved like a surgeon's despite the RN on her badge instead of MD. He had no idea who he was looking at. Nobody did. Sacred Heart smells like bleach and fear before dawn breaks. Elena clocks in at 5:52 a.m., 15 minutes before her shift, and the fluorescent lights buzz their mechanical song above the empty hallway. Her scrubs are navy blue, wrinkled from the dryer, and her name tag reads Elena Martinez, floor nurse, station 4. That's all anyone needs to know. She keeps her head down past the physician's lounge where Dr. Sterling is already reviewing charts, his Italian leather shoes gleaming under the bright lights, his silk tie perfectly knotted at the throat. She doesn't make eye contact. She never does. The slight limp from shrapnel in her left thigh is barely visible if you're not looking for it, just a hesitation on the third step of the stairwell. Most people don't notice. Most people don't look at nurses long enough to see anything real. In her locker in the basement, underneath her second pair of scrubs, sits a pair of combat boots. Tan leather, cracked and faded from desert sun, laces still caked with dust that no amount of washing will remove. Sanjin dust. She touches them once each shift, pressing her palm against the worn heel, letting her fingers trace the outline where her call sign used to be before she filed it down, sanded it smooth, erased the history one grain at a time. The boots should have been incinerated with everything else she left behind. But some things follow you. Some things refuse to stay buried. She closes the locker door without looking back. Morning rounds start at 6:15 a.m. Dr. Sterling moves through the pediatric ward like a man counting his kingdom, and Elena stays 2 steps behind, clipboard in hand, her eyes on the monitors rather than on him. She's good at this. Invisible. A ghost in blue scrubs. The children don't know that her hands moved like this once before, with a 14-gauge needle, with morphine in a pre-filled syringe, with pressure bandages on wounds that would haunt her forever. They just know that when she starts on 4, it goes in clean. First try. No rolling veins. No second stick. No tears. The parents notice, even if the doctors don't. Martinez, room 214, Dr. Sterling says, not looking at her. He's reviewing the chart for an 8-year-old with severe gastroenteritis, dehydration, labs showing electrolyte imbalance. Elena nods and moves ahead of him, her movements economical and exact, like every motion has been counted and measured and can't afford to be wasted. She's already prepared the room, warm compress on the child's arm, for tray organized, 20-gauge catheter loaded and ready. The boy, Marcus, is crying. His mother is holding his hand. This won't hurt, Elena says, and her voice is steady as a surgical laser. She doesn't promise it won't feel like anything. She just promises it won't hurt. There's a difference. She ties the tourniquet, finds the vein in 2 seconds, and the needle slides in smooth as silk. The flashback comes, bright blood in clear tubing, hands that aren't her own shaking, radio static screaming that casevac is still 15 minutes out. She pushes it down. Her hands don't tremble. Her voice doesn't crack. She secures the line, tapes the hub, and the 4-bag starts running clear liquid into the child's system. Marcus stops crying. His mother's shoulders drop 2 inches. Dr. Sterling watches from the doorway, his eyes narrowed. He's seen every nurse in this hospital start 4s. He's never seen one move like that. Like they'd done it 1,000 times. Like they could do it with their eyes closed. Like it was muscle memory from somewhere deeper than nursing school. By 8:06 a.m., Elena is sitting at her station reviewing charts, and that's when she sees it. A pattern. Small at first. Almost invisible. Room 206, pediatric patient, acute appendicitis, scheduled for emergency surgical removal. The invoice shows a standard laparoscopic appendectomy, single port. The charge capture shows for different surgical devices billed. Identical cost codes for each one. A $47,000 device used in a $8,500 procedure. She pulls up the next one. Room 218, inguinal hernia repair in a 5-year-old. 2 expensive mesh implants billed. 1 would have been sufficient. She knows because she's seen combat medics work with half the supplies most surgeons demand. She knows because she's coded trauma patients with nothing but gauze and prayer. The pattern becomes clear. Not random. Systematic. And Dr. Sterling's name appears on the preoperative consultation for 7 of the last 9 pediatric procedures. 7. The numbers stack up, and Elena's hands get very still on the keyboard. She doesn't take notes. She doesn't print anything. She just reads, and her mind, trained for 15 years to process threats and calculate angles and understand systems, sees exactly what's happening. Someone at this hospital is stealing from insurance companies by padding pediatric surgical bills with unnecessary equipment. And someone is profiting from it. She logs out of the system at 8:51 a.m. and walks back to the patient stations. Pain is information. Pain is data. Discrepancies are the same thing. They're signals. And Elena has spent her entire adult life learning to read signals that meant the difference between life and death. The conference room has glass walls. That's the whole problem. At 9:15 a.m., Dr. Sterling calls the surgical team together, 8 doctors, 1 administrator, and the door closes. Elena is restocking the supply cart 3 feet away from the glass wall, and she doesn't look up, but her ears are tuned to the exact frequency of that room. She's practiced this. Listening without appearing to listen. Observing without being observed. It's a skill that kept her alive in places where being seen meant being shot. Gentlemen, Dr. Sterling says, and his voice carries that particular tone of a man about to say something he finds amusing. I have a proposition. $500 says our new floor nurse quits within 7 days. Elena's hands continue stacking gauze pads into neat rectangles. Her jaw doesn't clench. Her breathing remains even. She's heard worse from better men, which is exactly what makes it hurt less. The laughter from the conference room is immediate, 7 doctors laughing at something they don't understand, at a woman they've never bothered to see. One of them, a younger surgeon named Dr. Chen, doesn't laugh. Elena doesn't see this, but it matters. It will matter later. Dr. Sterling leans back in his chair. She's too observant. Too competent. She notices things. That's a problem. Give her a week. She'll break under the pressure, or she'll realize she doesn't fit, and she'll walk. Either way, $500. Another doctor, what makes you so sure? Because, Dr. Sterling says, and Elena can hear the smile in his voice, people like her don't last in places like this. They either burn out or they wise up. Either way, she's gone by Friday. Elena finishes stocking the cart and moves down the hallway toward the pediatric ward. Her hands are steady. Her breathing is even. The small limp in her left leg is barely visible. She has work to do. 8 pediatric patients need vitals checks, and room for 47 needs his 4-bag changed. Room for 47 has a Marine in it. 26-year-old Private First Class James Holloway, transferred from Camp Pendleton with traumatic brain injury from an IED blast that took his entire squad. Comatose. No family listed. Only a tattoo on his left forearm that Elena sees every time she changes his dressing, a Valkyrie symbol with a name underneath. A name she hasn't heard spoken in 2 years. A call sign from a life that doesn't exist anymore. She doesn't linger in his room. She changes his 4, checks his monitor, and confirms his sinus rhythm is holding steady. I'm here, she says quietly, to no one. To him. To the person she was. I'm still here. She leaves before he can hear anything. That afternoon, when her son asks her about work, she tells him the truth. Or a version of it. How was Sacred Heart, he asks, and he's 10 years old and tired of eating microwave dinners while she works doubles. It was good, buddy, she says, and she means it. Helped some kids feel better. That's all that matters. He nods, because he's learned not to ask questions about why they moved to San Diego, why his mother sometimes wakes up screaming, why she keeps those old boots in her locker like they're made of something holy. She ruffles his hair and promises him pizza tomorrow, and they sit on the couch watching a show about people with normal lives, and Elena's phone, an old one with a Pentagon security line still buried in the contacts, stays dark and silent in her pocket like a sleeping gun. But that wasn't the worst part. The worst part was what Dr. Sterling was already planning, right there in his office with the door closed, as he picked up his phone and started making calls to people he owed favors, people who would help him make sure Elena Martinez understood exactly what it meant to be the only person in a room who noticed things she shouldn't have. The cafeteria smell, industrial disinfectant mixed with chicken broth and something burnt, hit Elena as she pushed the lunch cart through the double doors at 11:56 a.m. She'd timed her break to avoid the crowd. Mistake. Dr. Sterling stood 3 tables down, surrounded by his usual courtiers, surgical masks dangling from their necks like trophies. His voice carried the particular confidence of a man who'd never been told no by anyone who mattered. She kept her head level, kept moving, kept the cart steady. The rubber wheel squeaked with each push. Consistent. Predictable. Safe. Then his hand shot out and connected with the tray's edge. The crash was catastrophic. Mashed potatoes exploded across the white tile like a casualty scene. Green beans scattered in a radius pattern. The plate shattered into 3 pieces. She counted them automatically, the way she counted gunshot wounds, the way she counted bodies. 50 heads turned. The room's ambient noise died. All that remained was the sound of her heartbeat, steady as a cardiac monitor, and the soft ping of silverware settling on tile. Clumsy, aren't we, sweetheart? Dr. Sterling's smile was a wolf showing its teeth. His colleagues laughed on cue, a bark of sound that made the fluorescent lights seem to hum louder. Elena knelt. She retrieved the broken plate pieces first, protocol, containment, minimize the spread. Her hands moved with the precision of someone who'd dressed wounds in the dark, who'd run surgical procedures in a bombed-out aid station outside San Jin where the only light came from burning vehicle wreckage. Hands that steady didn't shake over spilled lunch. One tear escaped as she wiped the tile clean. She didn't sob. Didn't stiffen. Didn't retreat into the supply closet to fall apart the way the younger nurses did when they got corrected harshly. The tear was just a physiological response, salt water, involuntary release. She wiped it away without breaking eye contact with the floor, without acknowledging that Dr. Sterling was still watching, still waiting for the visible breakdown that would justify the bet he'd made with his friends. She stood. She pushed the dented cart back toward the kitchen. Behind her, the room resumed its normal noise, but the texture had changed. She heard Dr. Patel whisper something to another resident. She heard the clink of ice in water glasses. She heard, most distinctly, Dr. Sterling's chair scrape backward as he returned to his table, satisfied that he'd drawn blood. The worst part was knowing he'd taste it and want more. 2 hours later, Elena was conducting afternoon rounds with Dr. Sterling on pediatrics. She'd made it a point to stay 15 feet ahead, to keep her responses minimal, to be useful without being noticed. Invisibility was a tactic she'd perfected over 18 months of civilian work. Make yourself small enough that they forget you're there. Make yourself competent enough that they can't get rid of you. The balance was precarious, like walking a ledge. One shift in weight and the whole structure collapsed. They were reviewing discharge papers for a post-op case when Elena noticed something. The billing codes didn't match. Pediatric device installation, a relatively simple thoracic port placement, was coded at hospital level instead of procedural level. It bumped the charge from $8,700 to $24,500. Same with the cardiac monitoring equipment. Same with the surgical implant supplies. She'd spotted the pattern 3 weeks ago and started quietly documenting it, reviewing old records, cross-referencing insurance denials. She'd said nothing. Documented everything. Dr. Sterling must have sensed it, the way predators sense which prey has already noticed the trap. Because that evening, during the final patient review, he threw the chart at her feet. The pages scattered like cards. Her assignment was clear: pick it up. Do it. Now. The nursing station fell silent the way rooms do when a predator marks its territory. For other staff members suddenly became very interested in their computer screens. Dr. Chen developed an intense fascination with a blank wall. The fluorescent lights hummed their electric song, and Elena felt the weight of every eye that pretended not to be looking. She bent. Retrieved the chart. Stood. She maintained eye contact with Dr. Sterling the entire time. Her jaw was clenched, but her voice came out steady as a surgical laser, the way it had sounded in her old life when she was ordering people into fours and calling in medevacs and making decisions that meant the difference between recovery and bags for transport. I've been called worse by better men. The words hung in the air like shrapnel. Dr. Sterling's jaw tightened. His fingers clenched into a fist, then deliberately relaxed. He walked away without responding, which meant, Elena understood, that she'd escalated. The social humiliation wasn't working. He was moving into the next phase. Strategic. Calculated. Competent. That terrified her more than the cafeteria. She returned to her assigned patients, her assigned rounds, her invisible work. She did her job with a kind of meticulous precision that left no room for complaints, no room for legitimate criticism. But she also began subtly restricting access. When Dr. Sterling asked for pediatric device billing records, she informed him they were on a 14-day review cycle, not untrue, just a delay. When he requested her documentation files, she noted that her handwriting was a little unclear and offered to have her supervisor verify the details before release, also technically accurate, though the supervisor review would take another week. She was using his own bureaucratic systems against him, making the fraud harder to hide by forcing delays that created gaps in the paper trail, slowing him down just enough that he couldn't move cash through the system before the quarterly audit. She didn't know yet that this gambit would force him into something worse. Around 7 p.m., after the shift change, Elena checked on room for 47. The comatose Marine patient was still there, still unresponsive, still wearing the pale blue patient gown that made everyone look equally diminished. His vitals were stable. His chart noted he'd been unconscious for 43 days following a car accident that the police said was just an accident, except the paramedics had found him near the water with head trauma that didn't quite match the accident report, and someone, probably his family, had arranged for him to be transferred to Sacred Heart where he could receive quiet, consistent care without anyone asking too many questions. Elena changed his 4-bag with practiced efficiency. Checked the line for infiltration. Adjusted the pillow under his head, the way her combat medic training had taught her, support the cervical spine, prevent further injury, treat every unconscious patient like they might wake up and testify. As she worked, she noticed his forearm. There was a tattoo visible beneath the hospital bracelet. Just a partial view, but she could make out letters. A call sign. Her call sign. Valkyrie. That was a name she hadn't heard aloud in 847 days, a name from a life that belonged to someone else entirely. She finished the for adjustment and stood very still. The Marine's fingers twitched once. Just a muscle spasm, probably. Just the involuntary firing of neurons in a brain too damaged to process the world. But his eyes remained closed, his consciousness apparently unreachable, his identity locked away behind whatever barrier his body had erected to survive the collision that had nearly destroyed him. Elena left the room quietly and didn't allow herself to think about the implications. Not yet. Not while she still had a job to protect and a system to expose and a man in a white coat who was about to make his next move, the one she wouldn't see coming until it was already too late. But that wasn't the worst part. The worst part was happening 17 floors below, in the pediatric intake ward, where an 8-year-old girl with a Marine general father was just arriving in an ambulance, her scalp covered in spreading bald patches that 7 different doctors had already misdiagnosed, and Elena had no idea what was about to walk through those doors. Sophia Morrison arrived at Sacred Heart at 8:44 a.m. on a Tuesday, and by 9:15, 4 different pediatricians had already seen her and found nothing conclusive. The 8-year-old sat in the examination room with her scalp partially visible through thinning patches, her mother's hand trembling on her shoulder. General Morrison stood in the doorway, not in dress uniform, but still carrying that unmistakable weight of command, watching his daughter with the expression of a man accustomed to controlling every variable in his environment and finding himself completely helpless. The hair loss had started 6 weeks ago. Small bald spots the size of dimes. Then quarters. Then they began connecting across her crown like continents disappearing into an ocean. By week 3, her mother had taken her to their family physician in La Jolla. By week 5, they'd cycled through 2 dermatologists, 1 pediatric rheumatologist, and an endocrinologist who specialized in thyroid dysfunction in children. Each doctor ordered tests. Each test came back inconclusive or borderline. The pattern was familiar to anyone who worked in medicine. When specialists don't know, they order more tests and schedule follow-up appointments. The tests themselves became a kind of ritual, a performance of certainty masking uncertainty. By the time Sophia's parents arrived at Sacred Heart's pediatric intake ward, they had a folder 2 inches thick. Blood work showing slightly elevated ANA titers could indicate lupus or another autoimmune condition, but not definitively. Thyroid panel at the lower end of normal, potentially relevant, potentially nothing. Cortisol levels slightly off rhythm, stress-related alopecia was the working hypothesis from the rheumatologist. 7 doctors. 7 different opinions. 7 recommendations for medications that hadn't yet been prescribed because no one wanted to be the first to commit. General Morrison had finally made a decision the way he made all decisions. He chose the hospital with the best trauma center in Southern California, believing that the same doctors who could stabilize a critical gunshot wound could certainly diagnose a child's hair loss. He was wrong. Elena was checking vitals on a post-surgical patient in room 307 when the admit call came through: pediatric case, potential autoimmune involvement, order a full workup. She made a note on her clipboard and continued her rounds. She had no reason to expect this would be the case that would change everything. The morning had been routine: 6 patients, 3 stable post-ops, 1 with a low-grade fever that had already responded to acetaminophen. She'd avoided Dr. Sterling since the cafeteria incident 2 days prior, which meant taking the back stairs, timing her bathroom breaks, eating lunch alone in her car. The strategy was simple: be invisible, do the work, collect her paycheck, and spend her evenings with her 10-year-old son in their 1-bedroom apartment on the edge of San Diego, far from anyone who might ask questions about the combat boots she kept in the bottom of her locker or the way her hand sometimes moved through complex procedures with a precision that made other nurses ask if she'd trained somewhere special. No one needed to know. Invisible was safe. At 10:33 a.m., Sophia Morrison was moved to room 447 on the pediatric floor, and Elena was assigned to her care. The room smelled like new linens and antiseptic, that particular hospital sterile clean that attempted to mask fear. Sophia sat cross-legged on the bed, still in her intake clothes, a pale pink dress with a butterfly pattern that now looked too large for her frame. She'd lost weight. Not dramatically, but noticeable, the way a child loses weight when they're worried about something their body understands even if their conscious mind hasn't fully processed it. Her mother was arranging items on the bedside table: a stuffed animal seal, a water bottle, a phone charger. Rituals of control. General Morrison stood at the window, looking out at the San Diego skyline, his reflection in the glass showing a man trying to calculate how to wage war against something that couldn't be defeated with tactics or firepower. Elena introduced herself with her standard greeting: "Hi, sweetheart. I'm Elena. I'm going to be your nurse today. Can I ask you a few questions?" Sophia nodded. She had her father's jaw or square, determined. Elena took her blood pressure, temperature, checked her oxygen saturation, went through the vitals checklist with the efficiency of someone who had performed this sequence 10,000 times. During the examination, she noticed what the other 7 doctors had apparently missed. Or perhaps they'd noticed and dismissed it. Or perhaps they'd seen it and didn't know what it meant. When Elena leaned close to check Sophia's pupils with her penlight, she caught the scent on the child's breath. Almond. Sweet, faint, but unmistakable. And when she looked at Sophia's lips in the overhead light, she saw the cherry-red coloration that no one had documented in any of the 7 previous medical evaluations. The lips of a child who'd been poisoned. Elena's hands didn't shake. That was her first discipline, the thing that had been beaten into her during combat medicine courses at Fort Sam Houston and reinforced through 3 deployments where hesitation meant someone died. She finished the vital signs, made notes on the chart, and excused herself to the hallway under the pretense of retrieving the initial medication list. Once outside the room, she stood motionless for 3 seconds. Her mind was moving backward through the previous symptoms: progressive hair loss over 6 weeks. Cherry red lips. Almond scent on breath. Cyanide poisoning. The symptom presentation didn't match thyroid dysfunction or autoimmune disease. It matched acute to chronic cyanide exposure, the kind that happened when someone ingested it in small doses over time. Not enough for sudden collapse. Just enough to make a child slowly disappear. Elena walked back to the room and asked Sophia's mother a single question: has Sophia been taking any supplements? Any vitamins or wellness products? The mother's face changed. That particular expression of recognition mixed with defensive guilt that Elena had learned to recognize in her first month as a nurse. Wellness culture. Natural remedies. The specific vulnerability of parents who wanted to fix something when the doctors couldn't. She's been taking apricot kernel supplements, Sophia's mother said quietly. They're supposed to be very beneficial. Organic. From a wellness influencer I follow. I read they help with stress-related hair loss. Elena's jaw clenched once. Her expression remained level. Can you show me the bottle? Sophia's mother retrieved it from her handbag, a white plastic container with a label that used the words organic, natural, ancient remedy, and trusted by millions in progressively larger fonts. The dosage instructions recommended 2 kernels daily for children. 2 kernels. Once daily. For 6 weeks. Elena did the mathematics that 7 other doctors apparently hadn't bothered to do. 6 weeks of cyanide ingestion at that dose would cause exactly the symptoms Sophia was displaying. The hair loss was the least of it. The danger was systemic. Elena excused herself and walked to the nursing station where Dr. Sterling was conducting rounds with 2 residents. She moved with the kind of quiet purpose that made people look up before she said anything. Sophia Morrison needs immediate treatment for cyanide poisoning, she said. Her voice was level. Not a request. Not a question. Dr. Sterling looked up from his tablet with the expression of someone who'd just been told something deeply stupid. The child has an autoimmune condition. We're waiting on antibody results. He turned back to his tablet with the certainty of someone who'd won an argument. Elena placed the supplement bottle on the tablet's screen. Cherry red lips. Almond scent on breath. Progressive alopecia consistent with systemic toxicity exposure. Those symptoms don't support thyroid dysfunction. Dr. Sterling's eyes flicked to the bottle, flicked to Elena, and then flicked away. That last movement was the tell. He'd seen enough to understand what she was saying. And he understood the implications. If Elena was right, he'd misdiagnosed a child in his care while 7 colleagues did the same. Malpractice. Liability. Career damage that no amount of strategic maneuvering could undo. That's alternative medicine nonsense, he said flatly. The girl's parents were probably feeding her whatever nonsense they read online. We follow evidence-based protocols, not hunch and supplement bottles. Get back to your station. But as he said it, Elena watched his hand move to his phone. That was the moment the calculation shifted in his mind. If Elena was wrong, he could use this moment to finally build a termination case. Pattern of overstepping. Undermining physician judgment. Making unfounded accusations. A written complaint. A documented instance of insubordination during rounds. By tomorrow afternoon, he could have 3 board members on a call, and by Thursday, she could be unemployed. If Elena was right, Sophia would die while he waited for antibody test results. One option cost him his career. The other cost him a child. Dr. Sterling made his choice. He pulled Elena into the hallway and lowered his voice to the quiet register that was somehow more threatening than shouting. You are not to treat that patient. You are not qualified to make diagnostic decisions. If you touch that child without direct physician authorization, I will have your license reviewed by the state board. Do you understand me? Elena met his eyes. Her voice came out steady as a surgical laser. I understand you perfectly, doctor. She walked to the break room, closed the door, and sat alone for 30 seconds. Through the small window, she could see the pediatric floor. The hallway where Sophia Morrison was lying in a hospital bed, slowly being poisoned, while a specialist waited for test results that would come back inconclusive. Elena thought about the boots in her locker. Worn brown leather, the left one scuffed from a bullet graze in Sanjin that had missed her foot by inches. She thought about her 10-year-old son sitting in front of a television at 3 in the afternoon when the school called to say Mommy wouldn't be picking him up anymore. She thought about the promise she'd made to herself when she'd left the Marines: no more visibility. No more being the person everyone looked to when everything was falling apart. Just a nurse. Just a woman who pushed medication carts and checked vitals and lived quietly in the margins of other people's crises. Elena walked back to room 447. Closed the door. And began preparing the emergency equipment that would save Sophia Morrison's life. Elena's hands moved on their own as she approached the nursing station during morning rounds. Dr. Sterling stood surrounded by residents, his tailored white coat crisp as fresh linen, reviewing Sophia Morrison's chart with the casual certainty of a man who had never been questioned. Elena didn't hesitate. She closed the distance between them in 4 measured steps and spoke low enough that only he could hear. Sophia Morrison needs immediate treatment for cyanide poisoning. The room didn't go silent. Nobody noticed. Sterling turned to face her with the expression of someone who'd just heard a nurse suggest he perform open-heart surgery in the cafeteria. His smile arrived first, that particular smile that had made 3 residents transfer departments. The child has an autoimmune condition, not poison, he said, his voice carrying that edge of theatrical patience reserved for people he considered beneath argument. 7 different physicians have examined that child, Martinez. 7. We have thyroid panels, immunological workups, dermatological consults. What we don't have is hallucinations from the night shift nursing staff. He turned back to his residents. One of them laughed. Elena was already moving. Not walking away. Walking toward room 412. The MacGuffin object, her worn combat boots, scuffed leather the color of dried blood, remained in her locker, but her hands carried the muscle memory of 847 combat medical interventions across 3 tours in Helmand province. Hands that had done this exact procedure in a bombed-out clinic in Sanjin with nothing but a suction catheter, a nasogastric tube, and a prayer. Sophia Morrison lay in the pediatric bed, her 8-year-old frame impossibly small, her lips still bearing that cherry-red tint of cyanide toxicity. Her mother, Mrs. Morrison, sat rigid in the vinyl chair beside the bed, holding her daughter's hand like it might slip away if she relaxed her grip for a single second. General Morrison stood by the window, his shoulders carrying the weight of a uniform that had seen 3 continents. I need you out of the room, Elena said to the mother, not a question, not a request. A command delivered with the flat authority of someone accustomed to making life-and-death decisions when there was no time for democratic process. Excuse me. General Morrison's voice dropped an octave. Your daughter is being poisoned by those supplements, Elena continued, already pulling the emergency cart with the fluid efficiency of organized chaos. The apricot kernel compounds contain amygdalin. It metabolizes into cyanide in the stomach. The hair loss is necrosis, the body rejecting poison tissue. If we don't neutralize it in the next 40 minutes, she'll have organ failure. Liver first. Then kidneys. Then cardiac collapse. She didn't wait for permission. Her hands were already prepping the nasogastric tube with the kind of precision that comes from having done this while mortar rounds hammered nearby. The NG tube, size 16 French pediatric gauge, slid through Sophia's nose with practiced gentleness. The child gagged. Elena's hand remained steady as a surgical laser. "I need activated charcoal." 2 grams per kilogram, Elena called to the nurse entering behind her. "Stat. And get me sodium thiosulfate from pharmacy. Push priority. Tell them it's cyanide poisoning." General Morrison was still processing the word poisoning when Elena connected the syringe to the tube. Black liquid flowed down into the child's stomach. Sophia's body convulsed once, twice, then vomited into the collection basin Elena had positioned with the timing of someone who had performed this specific sequence 1,000 times across 3 wars. The vomit came up dark with activated charcoal and gastric contents, and yes, there it was, the sickly sweet smell of bitter almonds beneath the antiseptic. Pain is data. Every symptom tells a story. The red lips tell one story. The vomit tells another. The smell beneath the antiseptic tells the truth. The sodium thiosulfate arrived in less than 90 seconds. Pharmacy had listened to the magic word, cyanide. Elena prepared the push with the mechanical precision of muscle memory. 1 milligram per kilogram. For an 8-year-old girl weighing 52 pounds, that meant roughly 23 milligrams pushed slow over 3 minutes into the existing peripheral fall line. She'd memorized this protocol in a medical tent in Sanjin after treating 7 Marines exposed to industrial cyanide fumes during a chemical plant assault. The formula never changed. The urgency never diminished. Sophia's body relaxed incrementally as the sodium thiosulfate flowed into her bloodstream. The cherry-red color began draining from her lips. Within minutes, they returned to a healthier pink. The shallow breathing deepened. The child's eyes, which had been unfocused and glassy, began tracking movement again. "Her oxygen saturation is climbing," the monitoring nurse said, reading the pulse oximeter. 88%. 91%. Stabilizing at 94. The heart monitor showed the reassuring rhythm of a child's heart that was no longer poisoning itself. The hiss of the oxygen cannula filled the space where panic had been 30 seconds earlier. Dr. Sterling appeared in the doorway. His face went white in the way that only happens when a man realizes the world has just rearranged itself in a way he didn't authorize. His eyes moved from Sophia's stabilizing vital signs to Elena's face to General Morrison's expression, which had transformed from confusion into something that looked like the beginning of understanding. Sterling didn't stay. He left the room, and even Elena, with her laser-focused attention on Sophia's recovery, heard the distinct sound of his footsteps accelerating down the corridor. The speed of a man who had suddenly recognized that the game had changed in ways his network of board members and fabricated credentials couldn't fix. By 3 p.m., Elena was escorted to HR by a security officer whose name tag read Morrison, no relation to the general, but Elena wondered if the universe was running out of surnames. The termination letter was already prepared, as if it had been written before she ever touched Sophia's fall line. The words blurred together, practicing outside scope of licensure, insubordination, unauthorized treatment decisions, immediate termination effective at end of business hours. Dr. Sterling had moved fast. The calls to her listed references, the 2 fabricated employers he'd dug up somehow, the ghostwritten recommendation letter written in someone else's handwriting that contradicted every actual credential Elena possessed, had created a paper trail so clean it might have been laminated. She retrieved her locker combination from security and walked to the locker room where she'd kept her single talisman, the worn combat boots, laces frayed, leather creased from 847 patrols across Helmand province. She didn't take anything else. Badge. Stethoscope. The small framed photo of her son at his 6th grade graduation. All of it stayed. She took only the boots. The drive home consumed 22 minutes. She took the scenic route through Mission Hills, watching the afternoon light turn golden on the canyon walls. San Diego in early autumn was beautiful in the way that painful things sometimes are. The kind of beautiful that reminds you what you're losing. Her son, Marcus, was on the couch when she walked in at 2 p.m. on a Wednesday. The TV showed a cartoon he'd outgrown 2 years ago. He looked at her with the specific confusion of a 10-year-old confronted with the inexplicable presence of his mother during daylight hours when mothers were supposed to be at work. "Mommy, why are you home early?" His voice was small, uncertain. Elena sat at the kitchen table and didn't answer because there wasn't an answer that made sense to anyone anymore. The boot sat beside her on the hardwood floor, scuffed leather containing the compressed memory of 847 days she couldn't speak about and a military identity she'd buried so deep she thought she'd suffocated it. She'd left the service specifically to escape this. The visibility. The recognition. The weight of being known. She hadn't told her parents. She hadn't told her sister. She hadn't told anyone from her old life where she'd gone. She'd wanted to disappear into the anonymity of a floor nurse in a San Diego hospital where nobody asked questions and nobody knew that Senior Chief Petty Officer Elena Martinez had spent 3 tours being called Valkyrie because she never left anyone behind. But that wasn't the worst part. The worst part was that she'd come to love it, the quiet work, the invisible strength, the knowledge that she was saving lives without needing a call sign or a uniform to validate it. The worst part was that she'd almost believed it was enough. Almost convinced herself that healing without recognition was its own form of honor. The tears came quiet and steady. Her son sat beside her without speaking, the way kids do when they understand that some silences are more important than words. Outside, the afternoon light turned the kitchen walls the color of old gold. Elena didn't know that in room 447, the Marine patient's eyes were about to open for the first time in 6 weeks. She didn't know that General Morrison was reviewing her termination paperwork at that exact moment and making 3 phone calls that would arrive like distant thunder. She didn't know that a Navy SEAL team leader was already being mobilized by command to fly to San Diego by nightfall. She didn't know that the Federal Bureau of Investigation had been conducting a fraud investigation into Dr. Sterling's billing practices for the last 6 months and that her meticulous charting had provided every piece of evidence they needed. She knew only that it was 2 p.m. on a Wednesday and her son was holding her hand and she had nowhere to go in the morning except nowhere at all. The room was quiet except for the distant hum of afternoon traffic outside. Somewhere in the hospital she'd just left, a toxicology panel was coming back with results that would confirm everything she'd seen and done. And somewhere else entirely, a man who had spent his entire career making the quiet, strong people invisible was about to discover that invisibility had an expiration date. General Morrison moved through the hospital corridor like a man commanded by purpose. His dress uniform caught the fluorescent light, the medals on his chest a constellation of service that made every staff member straighten reflexively. He'd spent 43 years climbing the ranks of the Marine Corps, and he recognized competence the way a hawk recognizes movement in grass. His daughter was alive because a floor nurse had seen what 7 doctors missed. Now he intended to find her and look her in the eye. Room 447 was quiet except for the steady percussion of the heart monitor. The comatose Marine lay still beneath white sheets, unchanged from yesterday, unchanged from the day before. General Morrison had never met this particular patient. He was transfer overflow from Camp Lejeune, someone else's son. But as the general stepped through the doorway, the patient's eyes opened. Not gradually. Not with the confusion of someone waking from sleep. His eyes snapped open like a man responding to a command. The Marine's gaze found the general first, then tracked left, searching, and locked onto Elena standing at the 4-pump near the window. One word escaped his lips. Barely audible. Worn thin by weeks of silence. Valkyrie. The room stopped. The heart monitor continued its rhythm, sinus, steady, alive, but everything else crystallized into a single moment. Elena's hand froze on the 4 line. Her breath caught. Not from fear. From recognition. General Morrison's face went white. He stepped forward, his boots striking the tile with the precision of someone moving through tactical space, and when he looked at Elena his voice came out unsteady in a way a general's voice should never sound. Senior Chief Petty Officer. It wasn't a question. It was identification. It was knowledge. It was the moment the mask fell away. Elena didn't move. Didn't speak. but her free hand opened and closed once, muscle memory of holding something that was no longer there, a weapon that had been replaced by a stethoscope 18 months ago. "Your file," the general said quietly. He turned to the medical record in his hands with the careful deliberation of a man handling classified intelligence. "Pull it." "Everything." 30 seconds later, Dr. Patel appeared with the hospital record jacket. The general opened it with one hand while his other hand remained at his side, a position of readiness that never really left the Marines. The documentation was sparse at first. Birth date. Previous address. References to a fabricated employment history that Dr. Sterling had created to erase her background. But then came the scans, the digital copies that someone had uploaded from the Pentagon's protected server. 2 Purple Hearts listed. Separately. Deliberately. Each one representing a moment when bullets found her body and she'd still carried a wounded Marine to evacuation. A Navy Cross. The 3rd highest decoration in the entire Marine Corps. A medal reserved for extraordinary heroism in combat. The general's hands trembled. Actual trembling. Hands that had signed deployment orders for 10,000 Marines shaking as he read the single-page citation for a floor nurse who'd been pushing a mop through Sacred Heart Hospital for 3 months. The door opened without a knock. A man in a charcoal suit entered with the bearing of someone who'd spent 20 years moving through rooms where every face turned toward him automatically. But his face changed when he saw General Morrison. His entire posture shifted. The Navy SEAL team leader, call sign Breaker, still on active contract to run training protocols for NATO operations, took in the scene in 2 seconds, the general, the open file, the Marine in the bed looking at Elena like she'd just materialized from myth itself. "She saved Sophia Morrison's life," the general said without preamble. His voice had steadied, shifted into command register. Recognized cyanide poisoning that 7 doctors missed. Performed emergency gastric lavage and sodium thiosulfate intervention without authorization. Breaker stepped forward. His presence moved the air in the room, the kind of calm that comes from having already survived the worst, from having stood in rooms where seconds determined whose children would be orphaned. He looked directly at Elena. "Sanjan Valley," he said. January 2018. 12-hour firefight in the Jolin district. For wounded Marines. Hostile fire continuous. You dragged them through a kill zone while rounds were coming through the walls. 2 of them didn't make it to the LZ. You stayed with them anyway. Elena's jaw tightened fractionally. One muscle, barely visible, but Breaker saw it. Silver Star, he continued. Official citation sits in JSOC archives. Nobody outside the classified system knows your name. But everyone in SEAL Team 3, Charlie Platoon knows exactly what Valkyrie can do. The door opened again. This time it was an FBI field agent, credentials clipped to his belt, a folder thick enough to be a paperback novel tucked under his arm. He didn't introduce himself. He didn't need to. "Insurance fraud," the agent said. He opened the folder and let the document speak. Billing codes for pediatric procedures that never happened. Device supplier contracts marked with inflated prices. A kickback arrangement that had generated $2.3 million in fraudulent claims over 7 years. Your floor nurse's charting caught the discrepancies. Meticulous documentation. Military precision. She noticed billing codes that shouldn't exist for patients in pediatric oncology. Started asking questions. The general closed his eyes. Opened them. When he looked at Elena again, his face carried something that looked like grief mixed with pride, the expression of a commander who realizes his best soldier has been fighting without backup. An hour later, the hospital's CEO entered the main lobby in full view of the news cameras that General Morrison had called personally, a no leaked story, no anonymous tip. The press was here because he'd invited them. 11 o'clock in the morning. Every staff member within walking distance began drifting toward the marble atrium where something was about to happen. Nurses from 3 shifts. Residents. Attending physicians. The same personnel who'd watched Dr. Sterling humiliate Elena in the cafeteria, throw a patient chart at her feet, call her sweetheart with his smile like a wolf showing teeth. Dr. Sterling arrived looking confused, then angry, then, as the CEO began speaking, something like translucent. His face drained of color the way a water balloon empties when punctured. Dr. Sterling is terminated effective immediately, the CEO announced, his voice pitched for the cameras and the gathered staff. Termination for insurance fraud, kickback schemes, and medical negligence. Sacred Heart has initiated a comprehensive audit of all procedures supervised by this physician over the past 7 years. The cameras caught everything. The FBI agent stepped forward with documents. 23 pediatric cases where unnecessary equipment had been billed, unnecessary procedures ordered, unnecessary risks taken because the profit margin exceeded the ethical margin. The board members who'd owed Dr. Sterling favors had already tendered their resignations. The outside investigator he'd hired had become a witness for the prosecution. His entire network collapsed in 72 hours, not because one person spoke up, but because that person had documented everything with military-grade precision. Security escorted him through the lobby. His hands shook. His voice cracked when he tried to speak. The same nurses he'd belittled watched in absolute silence. Dr. Patel whispered to Dr. Chen, words meant to carry across the room like seeds. He destroyed his entire career because he was too arrogant to listen to a floor nurse. 6 months later, Elena would hear through hospital gossip that Dr. Sterling was teaching CPR classes at a community college for $14 an hour. The man who'd bet $500 she'd quit within a week was now demonstrating chest compressions to bored teenagers who had no idea they were learning from someone whose arrogance had imploded an entire system of fraud. But that afternoon, Elena sat in Sophia Morrison's hospital room holding the little girl's hand while soft dark patches of new hair grew across her scalp like evidence of resurrection. The apricot kernel supplements were gone. The real treatment was working. Sophia's voice had grown stronger over 3 days, no longer hoarse from chemical burn, bright with the particular joy of a child who gets to keep being a child. "My dad says you saved my life," Sophia whispered. Her small fingers squeezed Elena's hand with the intensity of gratitude only an 8-year-old could deliver. Elena didn't correct her. Didn't deflect. The transformation had already happened, and this was the new Elena, the one who'd retrieved her combat boots from the car where she'd hidden them, the one who was about to place them beside General Morrison's polished dress shoes like a question and an answer at the same time. The general stood in the doorway, no longer rigid in his uniform, but quiet in the way of men who recognize other warriors. His eyes held something like peace, the kind that comes from watching someone carry a burden for so long that you'd forgotten they were human and not mythical. "Your job is waiting," he said simply. "If you want it." Clinical nurse specialist. Trauma protocols. Training the next cohort. Elena looked at Sophia. Looked at the general. Looked down at the hand in hers, a child's hand, alive and healing because she'd trusted her own training more than 7 doctors' dismissals. "I need to talk to my son," Elena said quietly. "And my parents. There are people I left behind when I became invisible." The general nodded once, a gesture of respect between warriors who understood that some battles are internal. That evening, as Elena left the hospital, she carried the worn combat boots in her hands instead of hiding them in a locker. Someone had taped a note to her new locker, a nameplate that read Senior Chief Petty Officer Elena Martinez, Clinical Nurse Specialist. Beneath it, on a separate piece of tape, for words in handwriting she didn't recognize. "True class is what you do when the lights go out." She didn't know who wrote it. She kept it anyway. If you're still watching, hit that like button. And I want to know, would you have saved the man who fired you, or walked away? Drop your answer in the comments. Subscribe and let's see how this ends.